Representative Murphy, to your motion.
Thank you, Madam Speaker and members. Today, the decision about how we provide health care for sick and poor Minnesotans rests in our hands. A week ago, we passed a proposal off the floor with strong bipartisan support. The bill costs less than auto enrollment. It covers more Minnesotans and institutes reforms that will provide better care for the sick currently served in general assistance medical care. There's a handout on your desk that lays this out for us. Our proposal that we passed costs $281 million, but gains $30 million in federal funds. So the total state cost is $252 million. The administration's proposal of auto enrollment costs $254 million, earning no federal funds. Our proposal costs $457 per person per month. Auto enrollment costs $937 per person per month. Our proposal maintains the solvency of the Health Care Access Fund. The auto enrollment proposal requires significant cuts to the Health Care Access Fund, jeopardizing the health care coverage for working Minnesotans. The governor accepted these numbers. He said in our first meeting that he did not dispute these numbers. We worked over the course of the weekend to find a compromise with the administration. After 7 sessions, conceptual discussions, and offers that we made to move closer to the governor's position, including stronger reforms where there was a lot of common ground, an increase to the rates paid to providers, and offering to make our proposal permanent, repealing GAMC in current statute. After making these concessions, the administration returned to the refrain that this issue should be solved in the context of the budget and that they prefer to auto-enroll this population into Minnesota Care. They prefer the more expensive option, offering less coverage to sick Minnesotans. According to DHS testimony in December to a joint Health and Human Services Policy and Finance Committee, auto-enrollment of general assistance Medicare enrollees into Minnesota Care will yield a high rate of uninsurance and uncompensated care. Here's that math. Roughly 30,000 Minnesotans are enrolled in GAMC each month. Only 20,000 of those Minnesotans will be auto-enrolled into Minnesota Care. Only 5,000 of those Minnesotans will retain Minnesota Care post-auto-enrollment. Only 3,300 of those Minnesotans will retain Minnesota Care past the first renewal, and only 1,300 of those will retain Minnesota Care past the second renewal. Auto-enrollment will cost Minnesota taxpayers more for less coverage, but we were unable to convince the governor's staff of that over the course of the weekend. The auto-enrollment process is beginning now, unless we stop it today. And this was a major point of discussion over the course of the weekend. From the start of our work after the veto, we have been told that the process of auto-enrollment will begin on a firm date, and that date is February 28th. This is our last chance to put a more cost-effective proposal into place. That's why we're here today. I know I'm asking a lot of you. I know an override vote is a tough vote, but this is our last opportunity to stop the implementation of a more expensive policy. Today we are fighting for the vulnerable. Today we are fighting for what we believe. Today is policy before politics, and it is a test of our courage to lead as policymakers. I ask for your vote. Thank you.
Representative Surdich.
Madam Speaker, I move a call of the House.
Representative Surdich moves a call of the House. Seeing 10 hands. Seeing 10 hands, the clerk will take the roll on the call of the House. Representative Surdich.
Madam Speaker, I move that further proceedings under the roll call be dispensed with and the Sergeant-at-Arms be instructed to bring in the absent members.
Representative Surdich moves that further proceedings under the roll call be dispensed with and the Sergeant-at-Arms be instructed to bring in the absent members. All those in favor, please say aye. Opposed, no. The clerk will close the roll and the Sergeant-at-Arms will bring in the absent members. The member from St. Louis, Representative Huntley.
Madam Speaker and members, I urge you to stand by your vote today. Representative Murphy has given a number of reasons, and I'll give you several more. The first is that the auto enrollment for people currently on GAMC may work for some of the people on GAMC. But after April 1st, somebody new showing up at a hospital, perhaps a homeless veteran, will not be able to get into GAMC because it won't exist. And the delay time to get into Minnesota Care is at least 2 months. We've heard stories of where it takes 4 months. So that means this person in the hospital won't be covered by Minnesota Care for at least 2 months, and all the treatment that the hospital provides to that individual will be at the hospital's own cost because no one will reimburse them for that coverage. This bill, if we override the veto, will protect those hospitals and make sure that they at least get some payment for the kind of care that these unfortunate people need. And with that, I would again just urge you to vote to override the veto. Thank you.
The member from Anoka, Representative Abler.
Thank you, Madam Speaker. And here we are. I'm disappointed we have to come to this kind of a vote today. I offered some encouragement on Thursday that I hoped we could work this out in a better way. And I talked about signals, and the Senate signal and the House could actually find a better signal. I read the memo from Representative Murphy about the negotiations, and it looks to me like they're moving along. We sat for 14 days in the Human Service Conference Committee last spring, finishing at 5:45 on Mother's Day. Took 14 days to work out a bill that we could all agree on that the governor could sign. And that was, there were some cuts, there was some policy, there was considerable give and take, and marquee bills, hard negotiations take time. I can't imagine any major negotiation that I've ever heard of in the state or between a bargaining unit that was done in 5 days, especially if it was controversial. In fact, we have a law that says in the education negotiations, if you don't get it done by January 15th, that then you get a penalty. Well, that's 5 months into the school year. Couldn't they get it done in August? Sometimes things take time, and a lot of times that you get it done. I did vote for the bill when it left the floor, and I'll tell you why I voted for it. I can't speak for my other colleagues here, but I'll tell you what I had in mind. In the debate, we amended one of my pieces in the bill, which was a study, which was a placeholder for the purpose of going to conference. Now, you're going to vote today about retaining this program for 16 months or not. And there is no provision in the bill as it is to do what happens after 16 months. And so, in fact, and so that seems like it's an important little detail you want to know about. I'm trying to think of other bills that didn't go to conference, marquee bills. I think of stadium bills, I think of health bills, I think of healthcare reform bills, days upon days in conference. There's one bill I can think of that didn't go to conference that we did pass here. It was the Earhart bill. It was a transportation bill. It had a constitutional amendment in it, which the Senate blinked it up to the governor, And it was one of the worst worded amendments people remember, and we spent 6 months trying to fix that thing, and we didn't, and we passed a very curious amendment into the Constitution because we couldn't pull it back. And I think if there's ever an argument for a conference committee, it's that a story, and they're remembering that that's what we do. And so this is a big issue. It's an important issue. It's meritorious, and the people who are enrolled in it, some of whom will suffer harm if the current law goes forward, some of whom will suffer harm if this law goes forward. And what I want to encourage you is to not do this today. We shouldn't do this today. In those bargaining times, when they're across the table, they bargain in good faith. And as I read these things, I recognize a bit of the dance in these 5 or 6 days of negotiations. Coming, going, we offer, you take back. And it's all a matter of who can get the best of what they'd like. How can we find an honorable compromise is really the goal. And both sides are still figuring that out. But if you were in the middle of a negotiation for the teachers, which has been my experience before as I've watched my district, and then they do a walk through the school board with their T-shirts on and they look angry, that doesn't help negotiations. And it might even turn the edge on some of the board members to not negotiate so well, and it may actually result in a worse outcome. Madam Speaker, I am not kidding about my concern about this. Will this undo session? I don't think so, but it'll cost you a week. And a week that could be better spent in getting the bonding bill resolved, 8 more days of negotiations or whatever. Well, let's just review the bill that's in front of us, because the reason I voted yes to get it to conference is because I wanted a better bill than what we have now. The bill we sent there it's a nice bill. It does a few things better, but it does some things not better. So I need to help you understand what you're voting on. There's a piece, I talked to my county social service director today about the $19 million cut in the grants to the counties. Now, there has been little testimony, but much concern about that. And $19 million in mental health, child protection, care coordination, case management, and financial aid, financial worker monies is not nothing. And in another part of the budget, the governor adjusted those as well, and you weren't happy about those as a body. And so let me tell you what $19 million buys statewide. The average social worker in their benefits package gets about $75,000, and so on the average financial worker, it's $50,000, $60,000, counting all the benefits. So you can get about 15 workers per million, which means there's something in the range of 300 workers statewide that will be affected by this if they just balance their budgets in that part of the budget. And why is that interesting? Well, the average caseload of those workers is about 40 people, from 25 to 250, depending upon the kind of work they do. And so nominally, 40 workers times 300 is 12,000 people at county service levels who won't get what they need. They won't get the intervention early. They won't get the child protection. They won't get the mental health treatment. And so my wish in going to conference was to get rid of this part. This is not a good part. Nobody likes it. And so we're concerned about 12, 18, 30,000 people not getting general assistance medical care coverage. But these are 12,000 people likely not to get this for sure. And so that's a big deal to me. The second thing you want to know is that your clinic in Corcoran or in Biwabik or wherever who happens to serve these folks that come in are going to have their rates cut by 50%. Well, they're rich doctors. They have big clinics. It doesn't matter, right? Well, currently GAMC already pays below cost. And so every person that goes in from this group has to be subsidized by the people who own the clinic or who run the clinic. Many of those workers don't have health benefits. And so if they have to see people in there even more working for 50% of the cost, those workers are never going to see their raises. The clinic may actually have to have a policy about not wanting those folks. And so this is not a small matter either. I hope to work on this in conference along with whoever would be appointed, but at least on this side I was hoping to fix that part. Not one of the parts we like a lot. And so the net effect was that people will be driven to hospitals more. It will drive people away from the clinics to the hospitals, which is unreformed. And what I've been talking to you all about is we need to talk about growing our economy and redesigning all our programs. This is an undesign and not what you want to do. We can do better than this as a body, Madam Speaker. And we have even bigger challenges ahead. This is an easy one by comparison. You have a body on this side of the aisle says by 38 votes, let's work on it. We're here to be with you and to get this solved. And on some things, you're going to have 2 votes. That'll be harder. And you have a governor who didn't really like what he had to do, but he had to find general fund money to balance a budget. He turned it back to us last year on Thursday. There was 4 days left, and we didn't do much about that. We did interim hearings, had some sessions about talking about it. We still have time. April 1st is a long time away. Let me tell you something else about it. I've talked to many people. I've had many of my good friends, different groups that come in saying, can you vote for this today? And I said, no, I can't. Let me tell you what's going to happen under current law about the people who are enrolled now. They have 1 to 5 months of getting the service they wanted under Minnesota Care. If this goes forward in its entirety, the hospitals will get 70% of the money they were scheduled to get under General Assistance Medical Care in the Minnesota Care Plan. There's runs about that. But all the people that are now interested in this program, the community groups and the service organizations, the Lions Clubs, could pair up with these folks and help them fill out a form. If they fill out a form, they can be continued. If they pay $4 a month, 92% of the people are at the $4 a month level in this program now. And so I could see Lions Clubs putting together little fundraisers to help the $4 a month people, help our locals, help them stay in Minnesota Care. And you'll see a robust clinic project wind up under this, Madam Speaker. And the hospitals will be de-emphasized because it would be better for them to more carefully spend their money. So I don't mean to go on, but I want people to understand what this bill does and doesn't do. This is not the salvation of these people. I care about the people. I care about the hospitals. We can do better. And Madam Speaker, the reason I'm bringing this up with such fervency now is this will only tend to slow down a resolution, which by my count is 5 or 6 days into it. So, Madam Speaker, on Thursday I offered to give you one of my bills to use as a vehicle for this. Today, we need to stop this process of this action now. And so it's with great respect, Madam Speaker, that I move to table the bill, and I ask for a roll call.
Representative Abler moves to table the motion to the veto override. Seeing 15 hands, there will be a roll call on the motion to table. The motion is non-debatable. A yes vote supports Representative Abler's motion to table the veto override, to lay the motion on the table. A red vote goes against that. The clerk will take the roll. The clerk will close the roll. There being 46 ayes and 87 nays, the motion does not prevail. We are back on the Murphy motion. Representative Murphy.
Thank you, Madam Speaker and members. I want to go back to May and the veto of General Assistance Medical Care and the work that we've done over the course of the summer and fall. And I think it's important because there has been a tremendous amount of work on a bipartisan basis on this proposal. So we have worked in the House, Democrats and Republicans, we've worked House and Senate, and we've worked with the administration all summer and fall and winter to bring a proposal forward, actually at the request of the governor. Now, he didn't call me up and say, hey, Aaron, how about if you come up with a different proposal? But when he vetoed general assistance medical care and then further unallotted funding, he said that'll give the legislature time to bring another proposal forward. And we've always known there was a deadline. February 28th is the deadline. The commissioner confirmed that in our negotiations over the weekend. They're going to begin to auto-enroll people into Minnesota Care, which is a more expensive proposal. And by DHS's own testimony, it will cover far fewer people. These people are sick. So we have negotiated for 9 months. And we went further after the veto and spent 7 sessions over the course of the weekend talking about further reform with the governor. And there's some common ground there around the idea of an accountable care hospital organization, giving the hospitals a lump sum payment for a global payment to care for this population. But in the end, though, the representatives and senators at the table had a good conceptual conversation with the Commissioner of Human Services about that. In the end, we were told by the chief negotiator for the governor that they thought that this was a better discussion for the budget, and they stand firm on the process of beginning auto-enrollment. So we did not sever negotiations. We have no choice but to move forward with this today, or we will, in fact, allow the policy that is more expensive and covers fewer people to become the action of the administration. Thank you.
The member from Hennepin, Representative Loeffler.
Thank you, Madam Speaker and members. I rise to encourage all to join me to stand by their earlier vote in support of the reformed, cost-effective new approach to general assistance medical care. I think of the impact on HCMC, the largest provider of uncompensated care in Minnesota, to Minnesotans from all parts of our great state. It's a hospital that trains the doctors that all of us hope are smart and well-trained when it's a terrible diagnosis or an accident that interrupts our life or the life of our friends or family. HCMC should really stand for health care for Minnesotans consistently, because that has been its legacy and its history. A friend from Anoka County spent a month in the HCMC burn unit when there was an explosion at his work. I know of several families who had their loved ones brought in by a helicopter to my fair city when an accident or a severe illness exceeded the capacity of where they happened to be in northern Minnesota. I know a family outside of our county that cherished the care that was provided to their son, who went from a bright young man of promise to a person who could not control his thoughts, and whose hospital said, we do not have the trained people to help him deal with the schizophrenia that was ultimately diagnosed in that young man's life and brought him back to the road to stability. A very frightening and scary road for all. I know this weekend I met a community corrections worker who said we must be crazy to be thinking about ending GAMC care for people who are being released from our prisons and our jails, who have finally found stability for the battles that rage within their mind and cause them to act out violently and in ways that disrupt our community. He said to stabilize them in prison and jail and then send them out cold turkey without continuing medical care and access to those calming drugs is just nuts. I stand for the person who I represent, who just is confronting a terrible diagnosis and who is now confronting having to go at least a year, it usually takes longer, to have the federal government declare him disabled so that he can qualify for medical assistance. Until then, his only hope for paying those health care bills is GAMC. I stand for the health care jobs that have been lost and will be lost. I stand for the nightmares that will follow in the lives of many who depend on this program literally for their life and their sanity. The neighborhoods who will have more unstable persons in their midst, and the unfairness of life that will be magnified if we don't enact continuation now. All of us and all of our constituents are just a frightening diagnosis or a terrible accident away from losing our ability to work and to depend on the health systems and the health financing programs in Minnesota. I urge you to stand up for our constituents, for those who face frightening health problems today and in the next week and the next month, and do the right thing today. I urge you to stand with me and support GAMC's continuation.
The member from Carver, Representative Coles.
Thank you, Madam Speaker and members. My first session here in the Minnesota House of Representatives, it used to drive me absolutely crazy when we brought budget bills forward, and sitting where the majority leader sits now, former Representative Matt Intenza would stand up and say it's a sad day in Minnesota. It used to drive me crazy because, from my perspective as a freshman legislator, I didn't feel as though the minority at that time was doing anything other than criticizing, was doing anything to come forward with solutions. And so time and time again, former Representative Intenza would stand up and say, it's a sad day in Minnesota, and I would bristle. But members, I tell you that today, what's happening here on the floor of the House of Representatives right now makes it a sad day in Minnesota. What the majority is doing by coming forward with this attempt to override Governor Pawlenty's veto is giving up on the poor, is giving up on the people who rely on this program. What you're doing, members, is you're giving up on negotiations. You're giving up on the hard work that Representative Murphy, Representative Dean, Representative Huntley, and others have been engaged in for the last many months. There is nothing magical about today. But what you are doing here on the floor right now makes it a sad day here in Minnesota. Shame on you, shame on us for putting politics ahead of getting this done. It drove me crazy when Representative Intenza stood up and said that, because I felt as though the other side wasn't offering any alternative. But you know what? I know that Representative Murphy will absolutely agree with me that Representative Dean and others have been at the table trying to come up with a solution, working incredibly hard over the last not just days, but weeks and months. You know, members, I voted against this supposed fix of general assistance medical care when it was up here on the floor a week or so ago. I didn't vote against it because I don't believe that we need to find a way to provide health care coverage for these individuals. I absolutely agree with that. My concern then and my concern now is that we have a massive budget deficit. We all know it. It's $1.2 billion, give or take. We'll find out what the forecast tells us tomorrow. And we cannot solve these issues without understanding the implications on the budget. And Representative Murphy, members, there is nothing magical about today other than it really appears to this member as though we have one side playing politics and bringing an end to negotiations, suggesting that if we don't override today, that's it, it's done, we're over. Well, guess what? The override isn't going to happen. It's not going to happen. And I really, truly hope, Representative Murphy, that your comments about this being the end, that it's over, are not true. Because we need to find a solution. Republicans have been offering suggestions, have been sitting at the table, have been trying to help find a solution, and Democrats have been too. But what the Democrats are doing here today by trying to override Governor Pawlenty is we're sticking it to him. We're going to put a stick in his eye. Right in the middle of negotiations. we don't need to be done. Representative Murphy, I got to be honest, I've never seen somebody hand out a sheet that details the negotiations that have been happening like this before. I question whether that was a good idea or not, but that's neither here nor there. But what's clear, if you look at the sheet, members, the negotiations are happening. So why in the world would we bring up this veto override? It's not going to pass. You know that. The only reason you're doing it is for politics. It's a sad day in Minnesota.
The member from Ramsey, Representative Lilly.
Well, he's right, Madam Speaker and members. He's right. It is a sad day for Minnesota. I don't get up very often, to be quite honest. I'm very nervous about it. You know, my grandfather was a Navy veteran. He was on the USS Ward. You look at the end of the mall there, you'll see a cannon, the first shot. A lot of them were for St. Paul, and he wasn't on the ship at the time. He was over in Detroit making bombers for us to fight the war. But he was on the USS Ward. And I've heard a lot of speeches on this House floor from different members saying how important it is to take care of our soldiers and how all the work they've done for us. And I see one of them over there writing something down, and I'm not going to name names. But one of the things that are important to me from my grandfather, even though I wasn't in the military, he always said, take care of folks, take care of people, leave no one behind. I wasn't in the military. I know that much so. Leave no one behind. Many of these folks are people that have served our country. They were up there. We all stood and clapped for them. We owe them this. One way or another, we owe them this. It is a sad day. It makes me sick. I just can't tell you. I've had some of the same people saying they're praying for me, or they'll, you know, they want me to join their prayer group. You know, they'll stop me in the elevator and we'll talk and we'll have a nice conversation. And I happen to be a Christian, so we share some of those values. But they want me to join their prayer group. I just happen to look up a Bible verse to me that means something to me. I actually read the Bible a couple years ago. I don't know if anybody's ever read the whole Bible. It's kind of an interesting book. There's some good and bad in there. I got to admit, I don't agree with it all. But for me, it comes down to one section. Matthew. I don't know if anybody's made it to Matthew. But let me read this to you, and please indulge me. I don't get up on the floor very often. You can probably see my hands are shaking. For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink. I was a stranger, and you invited me in. I needed clothes, you clothed me. I was sick, and you looked after me. I was in a prison, and you came to visit me. Then the righteous will answer him, Lord, when did you see you hungry and feed you, or thirsty and give you something to drink? When did you see a stranger and invite you in, or needing clothes and clothe you? When did you see a sick person or in prison and go visit you? And Lord replies, I tell you the truth, whenever you did it for the least of these brothers of mine, you did it for me. Today's Monday morning. I don't know if anybody did anything yesterday morning, if they went to church. Maybe not. Sometimes I like to, quite honestly, I like to go for a run or do something else, and I kind of see some of that out in nature. But it makes me sick. It's a sad day in Minnesota. I agree with you, Representative Coles. This is not about politics. I've not said anything partisan. I don't intend to. I think the way the folks in our communities measure us is how we vote. There's no shame in me or anybody that votes yes on this. There's no shame in any of us that vote for our needy in our society. None whatsoever.
The member from Anoka, Representative Newton.
Thank you, Madam Speaker. Thank you, Representative Lilly. And I'd like to repeat some of what Representative Lilly is saying. We have 8,000 veterans who are on GAMC. These people suffer from mental illness. They suffer from addictions. Many of them are homeless. As Representative Haas was telling me the other day, they have the stand down in St. Cloud. I think you have it twice a year. We also have them in Minneapolis. There's an invisible brigade of these people who come out seemingly from the woods. They need haircuts, they need care for their teeth, they need health care, they need counseling. A lot of them need mental assistance. We try to put them in contact with our Veterans Service officers. We try to put them in contact with the VA. A lot of these people, quite frankly, were people that Representative Magnus and I may have served with in Vietnam. They want nothing to do with the government, any part of the government. They just want to be treated when they need it, and they'll disappear again, and they'll show up back in our hospitals. We have to make sure that we take care of these people. It's the right thing to do. And you know, we had the Red Bulls here the other day, and we all stood and applauded for their service and showed them recognition for their service. Let's show these 8,000 that we recognize their service as well by supporting an override of the governor's veto. Thank you, Madam Chair.
The member from Cass, Representative Howes.
Thank you, Madam Speaker. And first, I would like to thank Representative Murphy for her very hard work on this bill, and also for calling me yesterday and giving me an update on what's going on and what's happening. I did request of Representative Murphy that she would hold off on this for 48 hours. I know that in her heart she can't do that. She needs to do it today. Besides policy, it's also money. Everything is policy and money. Tomorrow we'll have our fiscal report. It appears, at least by the pundits, that it will be better. Could be better by as much as $400 million. I think this override vote or the structure of the bill would look a whole lot differently after noon tomorrow. So today, Mr. Majority Leader, if he's on the floor, I don't see him right now. I see him. I'm not going to vote until you call me to vote, because I'm not prepared to vote until after that fiscal report tomorrow. And I really think that we can wait 48 hours. And if we were to wait 48 hours and have a good fiscal report, and if the governor and those that are working on this cannot come to a conclusion by that time, then you've got my vote on the override, but not today. Thank you.
The member from Hennepin, Representative Khan.
Madam Speaker and members, I was originally going to stand to ask Representative Abler to yield for a question, and then I thought maybe I should ask Representative Dean to yield for a question, and then I thought, wow, there are 38 people who ought to be asked to yield for a question. But let me just give my remembrance of what the debate on the floor of that bill is. I did not hear one person say they were tentatively voting for the bill because they thought it would go to conference committee and come back better. Now, I apologize if someone did say it, so if you said it, you know better than I do, because I don't pretend to catch every word that's said in these lengthy debates. But let me tell you, there's a little pamphlet that you can get downstairs, and you can get it at the House Information Office also. And what it is it tells you how a bill becomes a law. And there is no requirement for a bill to become a law to go to conference committee, particularly for a bill that had had so much long-standing bipartisan, you know, with, I understand, the great help of Representative Abler and Representative Dean working on this bill before. A bill is passed by the House. If the Senate accepts it, it then goes to the governor's office. There was no requirement, unless there is an amendment added, for it to go to conference committee. When people see an emergency, and the people who don't see an emergency don't see the anxiety that's out there, haven't talked to the people who are caring for these people to understand how important this is, not to let another day go by without doing it. Now, you 38 people have a decision to make, and my yes vote was a very comfortable vote, and I'm very comfortably going to vote yes again today. It's your decision of how you can say that you had carefully thought out something well enough to make a vote, and now suddenly it's different, and you can't make that decision. And I urge you to join with us in overriding this very thoughtless and ill-considered veto.
The member from Stearns, Representative Gottwald.
Thank you, Madam Speaker. Madam Speaker and members, and perhaps to help remind Representative Khan, I'm not impugning her intent in any way, shape, or form, but I recall the debate on the House floor a little bit differently, Representative Khan, and members, I think it's good to maybe go over this ground a little bit. When this bill was last before us, we had a very good long discussion, debate, however you want to characterize it, where we had a lot of commitments from both sides of the aisle to work cooperatively, bipartisanly, beyond that day to improve how we're delivering care and services to people who need it under general assistance medical care. And we saw the goodwill and the apparent bipartisanship. And so people voted, I know I did, and having spoken with many members of my caucus, I'm pretty sure that's why they did it. The Green votes were, in fact, a show of good faith to say, let's work on this together. There's still process left to go. So, Representative Khan, while it doesn't have to go to conference committee, I think that was the expectation of most people. There was so much goodwill on the floor that day, it just seemed to make sense. And so some of us may be guilty of naivete or trust, but I don't think we're guilty of being dishonest. That was the vote that I took, and I know many of my fellow members on this side of the aisle took. That isn't what happened. All right? So then we came to a point where negotiations continued forward. And Representative Murphy, I appreciate you distributing the history on the floor. I would dispute the parts that say, walked away, no offer made. The truth is they've met all through the weekend for a reason. Everybody wants to solve this issue. The calls, the emails I've heard, the conversations I've had long before session started and during session indicate that what Minnesotans are most concerned about is taking care of the people served now under general assistance medical care. And both sides of the aisle members want to do that. Where there might be a difference is how we do it. And we discussed that in committee about Representative Murphy's bill that's now before us again. It only gets us so far. It doesn't answer the question long term. So again, we're making a promise we cannot keep. There are issues about how veterans are dealt with within this bill and within general assistance medical care in general. We agreed in committee it's not delivering the kind of care these people need most, primary preventive care. So there are reforms that we need to do to this program. We all know it. And there's a chance here as we negotiate bipartisanly to put those changes in place, to take up ideas from both sides of the aisle and set this program, or at least care for the people currently covered under that program, on sustainable footing so that we keep the promise. That's what Minnesotans are asking for, members. They're asking, will you care for these people? And the answer from both sides of the aisle is yes. But let's stop putting off till mañana what we can do today. We can pass a good program that better serves the needs of people in need and is sustainable, that is financially sustainable. Even with Representative Murphy's good work, there are still big question marks about the dollars in this bill, how it gets paid for, and what the unintended consequences are. It takes money from counties on a temporary basis. It leaves about $160 million kind of unanswered. And then we have tomorrow's budget forecast, which could tell us a whole lot of things about where we might be at financially, both in terms of Representative Murphy's bill and in terms of the other ideas that have yet to be worked into the negotiations that have been ongoing. So instead of taking the time to do this right, we've decided that today is an emergency, which it is not. It's a date on the calendar. There are some notices that are going out to counties and some software changes that are being triggered. But nobody's losing coverage today, members, and it's wrong to suggest that they are. We have time to do this right. And I'm concerned that the vote today is only meant to create more conflict, which we don't need. I've been talking with some of your members just today about the need to set aside the partisanship and continue working together on these big issues. So members, a vote to uphold the governor's veto today is a vote to continue good faith bipartisan negotiations towards a sustainable and reformed solution for the people most in need in our state. That's what it is. That's what it is. So you can feel comfortable voting whichever way you need to on this, but that's what it is.
Representative Murphy.
Thank you, Madam Speaker and members. I just wanted to clarify a few points that are coming up through the debate. First of all, the deadline. I have in my hand here the bulletin that's gone out from the Department of Human Services noticing the counties about auto-enrollment, and those notices are going out today. This was a subject of the discussion over the weekend. It has been a subject of the negotiation since we began, and Commissioner Ludeman reiterated again for us. The notices are going out. We're moving forward with the auto-enrollment. It is the point at which we are not agreeing in negotiation. They're moving forward with that policy. Bulletin here, notices going out, people are going to be moved into Minnesota Care, which is a more expensive policy, and by their own testimony, fewer people will be covered. Okay, so let's be clear about that. And we talked about it, Commissioner Ludeman said over the weekend, the more that we go forward with the notices going out, et cetera, the harder it is to wheel back. So he concurred with our point in the negotiations that there is a firm deadline. We're on that deadline, and that's why this is important. To the point of the budget, if we put this bill into law, we will help our budget situation. The cost of the old program is about $1 million a day between now and April 1st. We put this into law, we cut that nearly in half. So we begin to answer our budget deficit solution. On the point of the forecast, I don't know about members, I don't know much about the forecast. We haven't had an announcement about the forecast. We haven't had any briefing about the forecast. So while there might be good news in the forecast, that doesn't eliminate the fact that we have a decision to make today about the auto-enrollment, the deadline about that, and the need to move forward with this policy which covers more people for less money. So I understand that an override vote is a difficult vote, but this is not partisan. This is about us making the right policy for the state of Minnesota. We worked very hard through the summer and the fall. We were very clear in the hearings that we were moving quickly to try and meet and beat the February 28th deadline. We were very clear that we were working with the House and the Senate to make sure we were matching up our language, and we worked very closely with the administration throughout the process to meet or beat the deadline of February 28th, because once we pass that deadline, and we have, and I have the bulletin, the notices are going out and the process of auto-enrollment begins, which is more expensive for less coverage. Please support this effort today.
The member from Cottonwood, Representative Hamilton.
Thank you, Madam Speaker and members. And Representative Kahn, thank you for calling me out. I was one of the individuals that voted for that bill when it went off the House floor. And the reason I voted for that is because I thought we found common ground. I did. I thought we found common ground, and I thought that that was the answer to this difficult situation. You know, the override addresses one side of this issue, Madam Speaker, and often, all too often, when we think with our hearts, we forget to see all the details or recognize all the details. And what we must recognize is that there are people on all sides of this issue. And in its simplest of forms, we have people receiving benefits that they do not pay for. and people paying for benefits that they do not receive. And everybody is having a difficult time right now. Whether you have high unemployment, whether you have businesses that are closing, whether you are a sole proprietor or an LLC or a corporation, people are struggling. Times are tough. And we need to address this at a balanced approach. There's no question about it. And I was really encouraged when we had Representative Dean, Representative Abler, the hard work by Representative Murphy and others working together to find that common ground. And like I said, I thought we had that initially, but obviously I was wrong. And I still think there's time to address this, Madam Speaker. And when we're talking about politics, not allow politics to get in front of policy, I personally feel that it's the politics that is weighing in right here and right now today. Because we do have the February forecast coming out tomorrow. You have a number of people here that are wanting to debate this and be part of the solution in good faith. You have both the Democrats and the Republicans that are wanting to come to the table and work on this. And you can tell by the number of votes that the Republicans put up that we too want to find a solution. And unfortunately, the first time that went through, we missed a few things. And so now we ask everybody to come back to the table and work on this because we want a solution. There's no question about it. And I will strongly encourage my leader, if I could be so bold, to keep having individuals such as Dean and Representative Abler and others, Representative Gottwald, to continue working on this in good faith and bring forth solutions, because that's what we need. We need to have solutions as well. And to the majority party, we must recognize once again that there are people on all sides of this issue. It's not a party versus people or the governor versus people. We have people on all sides of this issue, and it's a difficult time for everybody. And so it's going to take Republicans, it's going to take Democrats, it's going to take the House and the Senate, and of course it's going to take the governor to have great debate, good open debate, to find common ground and work on a solution. I've taken the tough vote before. I was a veto overrider. And you know what? If you have the support back home, it's not that difficult. But again, the people back home and the people that we represent in this state, they want us to take a balanced approach. They want us to properly weigh out every angle and how this is going to affect everybody, just not one little segment of society. So I encourage my colleagues to uphold the governor's veto at this time around, get everybody back to the table, and work on a compromise. Thank you.
The member from Crow Wing, Representative Ward.
Thank you, Madam Speaker. And members, I rise today to stand beside the vote that I took a week ago in support of the GAMC bill that we came out with, and Representative Murphy, Representative Dean, all of the folks that worked on that, thank you. And I'm addressing all members of the House today, all 134 members. You received a letter from me, from the CEO of Tom Prusak, the St. Joe's Hospital, that says, in the St. Joe's Hospital, we stand to lose $800,000. This is in an area where the highest unemployment rate in the state, the city of Brainerd, for cities over 10,000, is occurring. We can't afford to lose any more jobs. Our families can't afford that. Our individuals can't afford that. Nobody can afford to do that. So members, I rise to talk about jobs besides the care that's going to be provided for the citizens of the state of Minnesota under GMC. And members, I want to just address, Representative Louie talked about it, some members on the other side of the aisle talked about it, talk about how we vote. How we vote, members. You know, 2 weeks ago, I had a bill in a committee that was a really controversial bill. And the advocates were trying to educate the members of that committee to try to show them how important this bill was. Finally, one of the advocates looked at me and said, Representative Ward, are we making any difference in what we're doing here and how we're trying to educate people, the legislators? And I looked at that advocate and I said, you know, ma'am, you are making a difference. Even though some members may decide prior to the vote how they vote, I believe most members do their research, do their homework, listen, ask questions, and then make their decision accordingly when the vote comes. Then last week, I had a young FFA member visit my office, and we were talking about being in the legislature, and that young man asked me, Representative Ward, how do you decide how to vote on an issue? And I told that member, that young man, Future Farmer of America, I told him, When I vote on an issue, I vote with 3 priorities listed in this order: my conscience, my constituents, and my caucus, in that order. And I told that young man, you know, my conscience comes around my values and my principles. And each one of us in here have different values and principles. And it takes courage at times to stand by your values and your principles and not be pressured into voting against those. Members, I stand by the courageous vote that I took last week and 124 other people took in this chamber last week. And I ask you to also let your conscience be your guide. And finally, members, the governor recently quoted as saying, God is in charge. And I couldn't agree anymore. I totally agree with that. God is in charge. And members, my faith and the God that I serve, the higher power that I serve, taught me early in my life that I need to take care of and fight for my brothers and sisters less fortunate than me. And members, those folks on GAMC, the sickest of the poor, sickest of the sick and poorest of the poor, are truly the members, are truly the folks that are less fortunate than us. So members, I ask you to join me in voting to override the governor, because it's the right thing to do. I stand by my vote. It's the right thing to do fiscally, ethically, and morally. Members, please let your conscience be your guide.
The member from Murray, Representative Magnus.
Thank you, Madam Speaker. Madam Speaker, would the author of the bill yield?
She will yield. Representative Magnus.
Thank you, Madam Speaker. And the question I have is, I've got 3 handouts on my desk, and I'm assuming everyone in the chamber has that. One that says that there are 78,000 people on GAMC. One that says there's 85,000 people on GAMC. One that says there's 38,000 people on GAMC. Representative Murphy, how many people are on GAMC?
Representative Murphy.
Madam Speaker and Representative Magnus, this is why it's such a good idea to work on an issue for such a long time, because you learn the facts. We know that there are roughly 30 to 35,000 people enrolled in general assistance medical care each month. And each month, that 30 to 35,000 people can change. Some of them are in for as much as 6 months. Some of them are in just for 1 episode of care. So when we talk about current GAMC, 30 to 35,000 people each month in their care. When we talk about our 16-month proposal, the temporary proposal, about 85,000 people. Over the course of that 16 months, will be cared for in general assistance medical care, the temporary provision. Thank you.
Representative Magnus.
Thank you, Madam Speaker, and thank you, Representative Murphy. It's a very confusing issue, a very emotional issue, and a lot of times the emotions get caught up in what we do, members. The second, I'd ask the member to yield again if she would.
She will. Representative Magnus.
Thank you, Madam Speaker. Representative Murphy, I'm still confused about the numbers a little bit, but I see on one handout you pass out that you say there are 8,000 of the 85,000 are veterans. Can you tell me what the number of veterans are that are enrolled in GAMC?
Representative Murphy.
Thank you, Madam Speaker and Representative Magnus. We believe between 8 and 10% of those currently enrolled in GAMC are veterans, so around 8,000.
Representative Magnus.
Thank you, Representative Murphy. Thank you, Madam Speaker. Well, we've heard some discussion today again from my colleagues here on the floor about what this means to veterans in the program. And when we debated the bill here a while ago, Representative Murphy, the author of the bill, had some veterans up in the audience looking at us and pointed them out. And I've read statements from a lot of people here that, in fact, from you, Madam Speaker, thousands of veterans are covered under the bill. And I don't deny that fact, Madam Speaker, and it is a sad day. My friend Representative Lee, you're right. It's a sad day. My friend Representative Coles, it is a sad day when 25% of the homeless single males, 25% of the homeless single males out there are veterans of our military forces. But members, I want to point out another debate we had last year when we were doing the finance bills. When we talked about the agriculture, rural economies, and the veterans bill, and we talked about a program maybe many of you don't recall, but a program called the Minnesota Assistance Council for Veterans, MACV for short. We greatly increased that funding for that program last year, and we did it for a reason. We passionately debated that amendment and segment in the ag committees, veterans committees, and we passionately debated it on the House floor, and our negotiators from the House fought for this in the conference committee with the Senate to get the vet and agriculture's bill done. Well, okay, what does it mean? What is this MACV, this Minnesota Assistance Council for Veterans? Because we've heard the talk today about the thousands of veterans on GAMC and nowhere else to go. That's the message the public is hearing from us. Homeless veterans with nowhere else to go. Members, that is not true, okay? It is not true. And I'm getting calls from my fellow veterans that are upset about using veterans, waving the flag for them to get this hopelessness turned around. And I agree with you. It is an emotional issue, and it is a hopeless situation for many people. Unfortunately, too many of them are veterans. But members, there are other programs for homeless veterans. Members, there's federal programs, including the award-winning program Minnesota Assistance Council for Veterans, nationally recognized. Less than a month ago was honored in the governor's office as a nationally recognized outstanding program to support our homeless and needy veterans. Members, there's 106 pages of benefits in this booklet that our veterans earned. 25% of the homeless males in the state of Minnesota are veterans, and that is sad. But when these folks go in to the social workers and the county workers and sign up for the GAMC programs, they ought to be sent to the VA if they don't want to do it themselves, and there's 24-hour service with the VA, with the Minnesota Assistance Council for Veterans. They ought to be told they qualify for that program. That's one of the earned benefits they had for serving our country. Earned benefits. They ought to be sent there so they can figure out and be assessed for the other 106 pages of benefits they have earned. Earned benefits for serving our country. Members, everyone in the state knows we've got tremendous financial problems here. You know, we've got to figure out how we're going to make ends meet, and it's going to be a tough battle and a tough challenge. We need to look at how we can leverage federal programs, get our veterans that earned these benefits into programs that can help them, not only for homelessness, Get them off the streets. Why are you coming back every 6 months with nowhere to turn and coming back to the trough every 6 months? Get some educational benefits. Figure out what programs you can help yourself with. Get yourself up on your feet. We had testimony here a couple weeks ago from veterans down there that talked about this program and said they were homeless. They were stuck in despair. They were in the mud up to their knees. They're living under the bridges. And I can take you to some of the bridges they're living under. Because I can tell you, I doubt anyone in this chamber or the Senate chamber has been to treatment facilities for people in despair with the demons dwelling on them every day, fighting this, as I have. But members, I can't stand silently by and have my fellow veterans waved up as a flag, as the poster children for homelessness. We've got other ways to help them. I know, members, it's an emotional issue. I know we've got people that need help. Members, send this bill back to the negotiators. Representative Murphy and Thiessen and others, you're doing a great job. Representative Dean, Abler, Gottwald on our side, and also to the governor and his staff. The solutions you have are not the right solutions. Go back to the drawing board and get us something that we can live with.
The member from Ramsey, Representative Murphy.
Thank you, Madam Speaker and members. Representative Magnus, I couldn't agree with you more that this is an emotional issue. And there are again with us outside of the chamber today vets, both those covered in GAMC and those not in GAMC, standing with their brothers in solidarity. We tried to address the vets issue in the legislation after talking with some of the county service officers who acknowledged that while there are vets benefits available, there are many veterans who are either not using them or cannot use them. I have a little data. There are many vets in the U.S. that are not covered by VA benefits. And according to a November 2009 Harvard Medical School study, 1.46 million working age vets in the U.S. lacked health coverage. The same study also found that an estimated 2,200 U.S. veterans under the age of 65 died last year because they lacked health insurance. It has been very difficult to have the vets come to committee and testify. I've told you about Caleb, who came. He's a Red Bull, just returned from Iraq. He's living under a bridge. He's suffering, struggling with reentry. He needs medical attention, and he's not getting it but through GAMC. There was another gentleman who came and testified on the same day. His name is Mr. Gunkel. He's a Vietnam War vet, and his son is serving currently in the Middle East. And he said, we made a sacrifice for this country, and he asked that we make a sacrifice for them by supporting this proposal. There are many veterans covered in this. We're working to make sure that we're tying them more closely with this legislation to the benefits that may be available to them. But there are barriers in place between state and federal law, and those barriers are creating cracks, and the vets who have served this country are falling through it. If we support General Assistance Medical Care, the temporary program, we'll capture those veterans, and they'll continue to get the care that they need so they can get back on their feet into the life they so richly deserved.
The member from Blue Earth, Representative Cornish.
Madam Speaker and members, nobody on the House floor or in the gallery or back home is going to make me feel any guilt or shame today. No matter how many times you bring up God into the conversation, I'm going to vote against the override. Representative Lilly, I was looking through my book here, fumbling for the page for offensive words. It gives me tough feeling when you and your members mention God in the debate here and then trot out your Bible whenever it's convenient. I urge you to trot that Bible out again when we talk about abortion. I urge you to trot that Bible out again when we talk about gay rights and what Christians feel about that, or some Christians. Don't do it just when it's convenient and try to make us feel guilty. I went to church too yesterday. I'll match up my church attendance any day with yours. And I went to a Heart for Haiti event, and I go to Nicaragua on missions. Now, the worst thing I can do is stand here on the House floor and boast, and I'm not doing that. But it's just to give you an idea that I have a heart too, and just because I vote against the override doesn't mean I'm any less of a Christian than you. When you vote to give too much money into a program, you're hurting other people too. You can be in very good conscience as a Christian, and I urge my fellow members here not to be intimidated today and go ahead and vote against the override. I'll justify it back home. I don't have to justify it to anybody here. And just remember, the next time, don't be afraid to trot out religion and be proud of it, but be selective. Remember when the person turned over the coin and said, render unto Caesar's what is Caesar's and what to God, what is God's? Well, excuse my language, but we've been given too damn much money to Caesar. And it's time maybe we buck up and take some of the heat on ourselves and help out with the programs back home. It's not government's responsibility to take care of everybody. Sooner or later, he depends on us Christians to help out too. So don't anybody feel guilty of how you vote here today. You can go back and justify either way you vote. Go ahead and vote the way you want to. We'll vote the way we want to. But don't throw God into the mix whenever it's convenient and make us feel like any less of a people because we vote the way we do. Thank you.
Members, I'll remind members of the body to not use offensive words. Representative Cornish, it's not okay to swear on the House floor. Representative McFarland.
Thank you, Madam Speaker. I don't stand on the floor very often. You all know that. But one thing that's happened since this whole GAMC issue has come up is I've gotten a lot of correspondence from my constituents, which you have too. But the ones that have bothered me the most are from the faith community. They have been misled by political action groups with mistruths. They come to me when I've sat and I've talked to them about it. They go, oh, that's really what's happening? And they don't really know, but they have been misled. And I feel the faith community should be treated better than that. And because of that, I will be voting to sustain the governor's veto so that we can go back and do what's right for the people of the state of Minnesota.
The member from Washington, Representative Dean.
Thank you, Madam Speaker and members. Madam Speaker, you asked us to come together to work for a solution that the governor could sign, and we have done that every step of the way. We continue to do that. Last week we had a bipartisan show of support for a solution. We realized that the governor's proposal was not perfect. We listened to folks, our stakeholders, and we said we need to make it better. The governor said, go together, keep working, keep working, keep working, find a solution. And that's what we did. And that's what we continue to do, Madam Speaker. We want a bill the governor could sign. You said that that is your preference. We would like to continue to do that. The outcome of this vote is certain. We know that we are going to uphold the governor's veto. The members of our caucus are doing so to return to the negotiating table. We think that that is our job. Our constituents want us to find a solution that the governor can sign, that we can enact into law. To that end, I'm wondering how this is helpful. And I want to be helpful in moving things forward. So I am going to be very brief, because every minute that we are here is a minute that we are not coming to a solution. It is true that the auto-enrollment process begins, but it is not irreversible. We have days to work through this. We can come to a solution. I would like to return to the negotiating table. I think the governor would like that. He's negotiating in good faith. So I am not going to speak very long, because it is, in my opinion, a waste of time. Number two, I'm not going to question anyone's motives on either side of the aisle. I think that that is not helpful. I want to know what's helpful for finding a solution as soon as possible. I'm going to continue to do that. So I'm not going to question anyone's motives on either side of the aisle, no matter how you vote. But our members are voting to return to the negotiating table. We think that that is very important. Representative Murphy, your heart is in the right place. I think you know our heart is in the right place. We need to move forward and find a solution. So I think that that is what we need to do, members. if we need this vote for whatever reason, I'm not going to question the reason that we're having this vote. I just want to return to find a solution as soon as possible. I would urge members to, number one, not question each other's motives or make that solution further away or harder to get. I don't think that's helpful. I don't think it's helpful to bring up the content of the negotiations thus far. I wish folks would stop doing that because I don't think that's helpful. But please, members, let's take this vote. If we need this vote for whatever reason, let's take it and get back to the negotiating table. Thank you, members.
Representative Magnus.
Thank you, Madam Speaker. And just a point to respond to the author of the bill that brought up the Red Bulls again. Members, as I mentioned in my previous remarks, the veterans qualify for a lot of programs, and I didn't get into all of them. But the federal programs are 106 pages long in this book. But members, the Red Bulls, and Representative that's carrying the bill, Representative Murphy, the Red Bulls qualify for an additional benefit. They get 5 years of medical coverage when they return. Thank you, Madam Speaker.
The member from Hennepin, Representative Thiessen.
Thank you, Madam Speaker. The vote last week that we took 125-9 in favor of this bill reflects where Minnesotans are about this issue, and I think we're hearing that agreement on the floor today, which is that we want to take care of our most vulnerable people in Minnesota, that we feel we don't just have a political obligation, but a moral obligation to do that. And I'm hearing agreement about that. Minnesotans, it also reflects where Minnesotans are because it's the more fiscally responsible alternative. Representative Murphy's bill is more fiscally responsible than auto enrollment, and that is the key thing that's going on here today. The choice before us today is not to stop negotiating to make this program even better. We can continue to do that. It is not to stop that process of going forward. Our decision today is simply a choice between are we going to go forward with auto enrollment, the more expensive option, or are we going to go forward with the bill that Representative Murphy has come up with, which is a start in the direction of everything that we've been talking about, moving towards primary care. There is movement in that direction. Some of the information, or the language that Representative Dean added on the floor moved us even further in that direction. So this is not a stop to negotiations. What this is a stop to is moving in a more it's a start towards moving in a more fiscally responsible direction. I do also want to just mention the fact that we have been working on this for at least 9 months. You know, right when the veto happened, we went out, talked to hospitals and communities all across the state. We brought in a lot of information. We met with the governor. We met with a lot. All of us on the House floor did. Republicans and Democrats alike were part of those tours, Representative Gottwald. And we worked very hard, and we made it clear when the governor came out with auto enrollment, we being the Representative Murphy and others, that wasn't a good option for us. That was several months ago. We had a hearing in December where we invited Representative Dean and the Republicans to come forward with their proposal, which we heard. We invited the administration to come forward with their proposal. Nothing. There was no proposal that was put on the table as part of that hearing. Since then, we've continued to reach out and do that work, and there has been movement forward in that direction. I would say that there's no fiscal note on either Representative Dean's proposal, the proposal that Representative Gottwald brought forward. We have done the hard work in trying to fix this program. There's been bipartisan work in that direction, but I think the hard work of actually getting a fiscal note, getting the work done, getting things on the table. You know, we were going to have a hearing in Representative Huntley's committee on Representative Dean's bill. Unfortunately, he had to pull the bill because there was no fiscal note. So I think the hard work has been done. This is a good proposal. Is it perfect? No. Is it the stop to moving forward and continuing to make this a program that actually serves these people better and better and better? No. What this is a decision is, do we go down the more expensive and less useful option, serving fewer people, of auto enrollment, or do we move in a direction that actually starts to reform the program? And no one can deny that there's start of reform in this proposal, is more fiscally responsible, and gets us in the direction we need to meet. That's all that's before us. 125-9 was the right vote for Minnesotans. The one veto, I think, was the wrong direction. I would encourage us to move forward together as we did a week ago, with another 125-9 or even 134-0 vote to move this legislation forward, get us going down the path of actually moving in the right direction, and then we can continue to work. And, you know, we're holding a hearing on your bill, as you very well know, Representative Gottwald, on Wednesday. It's been posted. And so, in any event, that's what I would encourage members to do. We do have a solution here. It's not that we don't have a solution. This is a good solution. It's a fiscally responsible solution. It's the right moral solution because it's helping more Minnesotans who are the most vulnerable among us, and it doesn't stop negotiation, it starts it. So I'd encourage you of a yes vote on this bill.
The member from Hennepin, Representative Dietrich.
Thank you, Madam Speaker. I, too, don't often get rise to speak in favor or opposition to bills on the House floor, especially a health care bill. But sometimes there are issues that are close to your heart, and you must stand on behalf of the Minnesotans and the community that you represent, and this is one of those times. Last year, as we voted on the GAMC bill, you might remember that I spoke as a mother and a person of faith to override Governor Pawlenty's veto. I still feel those same compassion-based arguments today that merit an override vote today. But this afternoon, thanks to the work of Representative Murphy, Representative Abler, Representative Dean, my reasons for voting yes are based on much more practical reasons. The fact of the matter is, this solution is far less expensive than the governor's plan. The fact of the matter is that this plan covers more people. The fact of the matter is that our deadline has arrived. And I know for Mercy Hospital in Coon Rapids, in my district, the difference between this plan and the governor's plan is $3 million. $3 million that do not need to be borne on the backs of property taxpayers, $3 million that do not need to be borne in the form of higher premiums for those people who are already insured. Sometimes we have to vote on issues where we stew for days as to am I in favor of it or am I not? Today is not one of those days. Today I will be voting with conviction to reform and affordably restore GAMC. I'm proud to stand by my vote today. Thank you, members. Thank you, Madam Speaker.
The member from LeSueur, Representative Broad.
Well, thank you, Madam Speaker. And Representative Thiessen, it's not exactly accurate to suggest that there were no ideas at that hearing because Representative Dean sat right at that table and brought one forward. Representative Dean has worked very hard in bringing ideas to the table, and not only ideas, but real solutions. Real solutions how we can solve this problem that we all know on a bipartisan basis that we need to solve. You know, there's a false choice being offered to the people of Minnesota with this override attempt here today. The false choice that's being offered is that we can either override the governor today or all these people go unserved tomorrow. It's a false choice. The choice we have today is actually whether we continue the negotiations and find a solution, a real solution, a good solution, a long-term solution that we can all agree on, that can get signed into law and sustained going forward. We don't want to just pass a bill, which is what this override attempt is about. It's about passing a bill. We were told on the House floor that the bill wasn't quite perfect yet. It wasn't quite there yet, but we were going to continue those discussions in conference committee. Well, why on earth would we want to pass a bill that isn't perfect and that isn't right and that may not work? Why wouldn't we want to show to the people of this state that Republicans and Democrats can work together, not just to work together, but actually to solve the problem in a real way, in a long-term way? You know, one of the things that I've been excited about with this GAMC discussion is that this is one of those examples, I think, that we could show the people of this state, hey, you know what? Republicans and Democrats can work together. They can work together to solve real problems. They can set aside the partisanship, the politics, to solve those problems. I've been excited about that. I've been talking about that. Too much of what we do isn't about that. This is one of those great examples, yet here today it runs into a roadblock called politics. And it's not politics for the sake of not wanting to serve the people. It's politics related to passing a bill that we actually had bipartisan support on, but not passing it in the appropriate way to move to conference committee to get it signed, sealed, and delivered, but passing it and then shoving it onto the governor's desk. Why? because he might have been out of town that day. We have got to solve this problem. The worst thing we can do is stop negotiations by this override. The best thing we could do, Madam Speaker, you pulled back a bill before in the bonding bill. I'd like you to hold back this override attempt today so that we can get back to the table, get real negotiations, and so that we can have a real choice, not a false choice, for the people of this state. You know, we hear a lot about morality of government. We hear a lot about compassion of government. Well, I don't know that government can be moral or compassionate. I think that's reserved for the people, for us. We continue to make promises in this state to the people who need assistance that we know cannot be kept. The math doesn't work anymore. So we've got to reform the process of government, reform the programs of government in a real way, in a way that actually serves people better longer term and that doesn't burden our kids into the future. We were really on that path. We were actually on a great path, a path that Minnesotans could be proud of, but today that path runs into a roadblock called politics and partisanship. There was a lot of Republicans who were excited to work with Democrats on this issue. We were excited to put forward something that we knew was moving forward in the process. In fact, I wrote it down. The bill's author suggested that that's what was going to happen. We're going to move it along in the process. That was what that vote was about. We're going to move that bill along in the process so that it can continue the negotiations with the governor so we could solve this problem in a real way. But unfortunately, this override attempt today is going to hinder that process. This override attempt today will fail, but unfortunately, my fear is that the real problem solving will fail along with it. I want to see us back at the table. I want to see us actually solve this problem as Republicans and Democrats and independents. This problem could be nonpartisan, not bipartisan. This could be nonpartisan if we do it right. So, Madam Speaker, I hope that you might just hold back this override attempt today, and maybe that's something that you could do. We've done it with the bonding bill. You put the bonding bill out there, pulled it back. We could do that here today. That would make sense. That would be the approach that is actually about leadership and solving this real problem that Republicans and Democrats want to work together on. Members, this is a false choice being offered to us today. It's a false choice being offered to the people of this state. Not overriding the governor is not about not serving these folks. We need to serve these people in a way that makes fiscal sense, in a way that actually gets them the right care at the right time in the right place. And we can do that by working together. This override attempt is actually moving us in the wrong direction, and I'd urge you to vote no.
A member from Stearns, Representative Hash.
Thank you, Madam Speaker, members. Before I go into my speech, I first want to thank Representative Murphy for serving with honor, dignity, and grace in this process that is difficult. I think she's served this body well, regardless of what side of the aisle you're on. So I want to thank her for her work on this. First, there's many costs associated with this bill. That's undeniable. The first one I want to talk about is the fiscal cost. Representative Broad, you talked about doing this in a fiscal responsible way. I want to give you a few numbers. Per enrollee per month, the cost under the bill we're discussing today is $457. Under the alternative, the auto enrollment plan is $937 per person per month. Double the cost. Secondly, we have economic costs. In my area, St. Cloud Hospital, a regional center many of us represent in this body, is going to lose $6 million. $6 million that has to be made up primarily through two ways. One is by the layoffs or the loss of jobs within the healthcare delivery system, or by increased charges that are going to be borne within our premiums. The alternative, in my mind, is unacceptable. But the costs that are most important are the human costs. And I've seen these human costs, folks. If we do not do something, there will be individuals, because of the loss of their GAMC, two things are going to happen to them. Either they're going to show up in the emergency room, in which is the most expensive, least efficient delivery of care, or they're not going to come home. There are people that I work with that I know that unfortunately, is going to be their two options if we don't override this veto. And that's unacceptable. Many of these people on GAMC are individuals who have been recently disabled. They've been recently disabled maybe because of a stroke or a car accident or some catastrophic accident that has made them unable to work, and because of our bureaucratic process at the federal level, may not be able to get disability for a number of months. Our most vulnerable, people who we may be the next ones, or our loved ones may be the next ones that have to rely on GAMC. We've talked a lot about values today. I have my values rooted in my faith and in my upbringing. Our bishop in our diocese sent a letter about the importance of maintaining the dignity of all humans and making sure that we work on this issue. It was quoted that when we deny health care for any human person, we ignore their human dignity. And when we ignore their human dignity, we fail to recognize and value human life itself. And I don't think this is simply rooted in our faiths. I think this is rooted in our communities. In Minnesota, we've been a shining example of how things can work for the betterment of everybody. I want to make everybody remember when they first ran for public office. I remember when I first ran. It was in 2004, which, by the way, folks, 2004 was the year of flip-flops in that presidential election. But I think everybody ran rooted in wanting to make a difference, rooted in being bipartisan, looking for solutions, and working hard. I think if you go back to your campaign literature and your ads, that's what you would see. I think most of us would see that. This is the time that calls for that bipartisanship and working for solutions. I walked off this floor when we passed GAMC with a bipartisan 125-9 vote, proud to be a member of this body. What happened was what my constituents and I think Minnesota expect us to do. And that's to work on tough issues, listen to the concerns, and work together and try to find solutions. We did that day, and we can do that again today. Now, we are in a unique place as representatives and leaders of this community. We can make a difference for thousands of people. We can make lives better and help out our most vulnerable. It is an awing responsibility that we all have. The costs are too great to not override this veto. The costs are more expensive with the alternative, hurt our local economies more with the alternative, and the human cost, which is most important, will result in, I think, the betrayal of our most vulnerable. Members, make me proud, make Minnesota proud. Let's vote to override this veto. Let's have that bipartisan solution that we all talk about and go home to our constituents and speak to. And let's have our actions prove true today with an override. Thank you.
The member from Stearns, Representative Gottwald.
Thank you, Madam Speaker. Madam Speaker and members, Representative Hosch, the other option is the third option. We've heard talk about the governor's alternative versus the bill that Representative Murphy and others helped put together. And it's the same kind of false choices we've been offered time and again. Do this now, or you end up with this, and that's bad too. And then there's the negotiations that have been going on. And I'll tell you why this is important to me and some others from my side of the aisle is exactly what you were talking about, Representative Hosch, about the conscience and the care for people in need. Because we are making promises that we cannot sustain time and time again. We are making commitments we can't deliver. We're looking at short-term solutions to long-term problems. We've heard testimony over the last 3 years about what's going to happen to the Health Care Access Fund. I could ask several members to yield here and explain to me exactly what happens if Representative Murphy's bill is passed into law and we override the governor. Will it keep the promise to these people long term? And the answer would come no. We don't know what we're going to do a year and a half from now. We don't know what we're going to do in a year and 2 years after we've expanded eligibility for numerous public programs and created these great benefit sets and made all these promises, and then we're going to hit this brick wall. At which point state law says we have to disenroll people. Not from the top, from the bottom. So what are we holding out for? What do we want the negotiations to continue on for if we've got this instant fix right here before us? We're holding out for sustainable solutions and reforms that put us on a sustainable path. Members, that's what Minnesotans have been asking for. Prioritize your spending. Make sure you're taking care of the poorest of the poor and the sickest of the sick first before you expand eligibilities and add other people and create other programs and expand government. That's what Minnesotans have been asking for. With all due respect to this bill, that isn't where we're at. And so many of us on our side are saying enough. Get to the negotiating table. Take the time before you to make it work long term. Put it on a more sustainable footing. Representative Thiessen, I'm not so concerned about my bill. I've heard many people bring it up. It's a piece of the solution. It can be. We believe it can be very helpful, but it's not the whole solution. Representative Murphy has good ideas. Representative Dean has brought up good ideas, and other members of the legislature have good ideas for putting us on a sustainable path. If we learn nothing else from this session, let's learn this. The time for short-term fixes is past, and Minnesotans want long-term sustainable solutions that do not rely on continuously expanding government that continuously costs us more. Now, Representative Hosh, you referred to some math with which I'll frankly disagree. We spend almost $1,000 per person per month for general assistance medical care right now, $1,000 per individual. And the best that we can do is that most of them end up inpatient in settings where the care is delivered at the most expense. So we can argue about the governor's automatic enrollment in Minnesota Care, which again is a short-term fix. Or we can talk about Representative Murphy's bill that does it for somewhat less, according to that math, and does it for a short term. And we will still come back maybe after the election. And the next governor and the next legislature will have to find a way to keep the promises that we're constantly making. So the message here is go back to the negotiating table and make promises we can keep bipartisanly, instead of pointing the finger and saying your idea is better than that one is better than that. They're all short-term fixes. They don't keep the promise to the people in need, members. And you'll simply place this on the back of another legislature and another governor at another time. That's not responsible governing in my book. The time is now. The negotiations have been progressing. It's what we wanted when we voted it off the floor here. I agree with you, Representative Hosh. I was proud that day too. Proud to embrace a bipartisan process that results in a sustainable solution, a promise we can keep to the people most in need of Minnesota. So my vote to uphold the veto today is a vote to continue that process.
The maker of the motion, Representative Murphy.
Thank you, Madam Speaker and members. As I've said from the start of the debate today, it is a difficult question before us. Should we override the governor's veto? It is a difficult question, but it's not a partisan question today. Overriding the governor's veto would be an extension of our bipartisan effort. It would be an acknowledgement that we recognize the difficult budget the difficult budget problems we have ahead of us, the deficits that we face this session and the session ahead, our proposal costs less than the auto enrollment. It costs less and covers more than the auto enrollment. That is a solution. Not the entire solution, but a real solution put before us today in terms of the deficit. Auto enrollment puts the Healthcare Access Fund into deficit, and the governor proposes eliminating a bunch of people out of Minnesota Care in order to make that work. That's not a fiscally responsible solution either. And in the negotiations that you continue to ask us to go back to, the governor's staff were crystal clear that auto enrollment is going forward. That's why we're here today. Because if we don't move forward with the override and put this more fiscally responsible proposal in place, auto enrollment will proceed, it will cost the state more money, fewer people will get coverage, the Healthcare Access Fund will go into deficit, and working people will begin to lose their coverage. I know it's hard. I know that this is a difficult debate for some of you. I am thrilled for all the work that we've done on a bipartisan basis, and I've never stepped away from a negotiating table. I didn't last night until it was clear that we were done. But today is the day that we have to make a decision about auto enrollment and the expense that incurs and the lack of coverage, or the more fiscally responsible proposal before us. Thank you.
The member from Swift, Representative Falk.
Thank you, Madam Speaker. I come from a rural district, and perhaps you've seen I have 5 counties listed on the plaque in front of my desk: Swift, Big Stone, Lackaparro, Yellow Medicine, and Lincoln counties. I'd even contend with some of my friends from the north that my district's probably more rural than any else in the state. Those to the north have either a state or a national forest. And one thing that highlights this is the largest city in my district is Benson, Minnesota, population just under 3,400 people. But what does this mean coming from a very rural area? Well, we have a lot of small towns that we rely on to provide the services. And one of these things that's very important is the small hospital. In my district, there are 9 small hospitals, more than twice as many as any of your districts. We talk about what it takes to keep a community strong. One of the things we look at is our hospital. The other pillar is oftentimes the community, in the community is the school. These centers, they provide meaningful jobs. They provide a sense of ownership. They keep people rooted in these rural parts of the state. I'm not rising to speak on all of the merits that people have brought about. There are many great points that have been discussed. But my issue is that if this proposal goes through, this auto enrollment, many of my small hospitals will lose a significant source of their funding, that portion of GAMC, which is often the break-even point. What happens if we lose these small community hospitals? What happens when you need services? What happens in these areas where we have lower population? It's further to drive. If you have a farm accident, if you have a car accident, if a loved one has a stroke or a heart attack, where do they go to get the service they need if these small hospitals are not able to be there to provide the services and the care that we all rely upon? For me, this is a very simple vote. I'm voting to protect my hospitals. And it's simply for the fact that their margins are so slim that they need this program to go through. And I appreciate the work Representative Murphy has put forward and all the work that people have done, because this is a solution that's going to work to keep these hospitals open in this very, very difficult time. There's a time for action. There's a time for leadership. Right now, we must lead. This proposal brought forward covers more people for half the cost and provides a better quality of service. My decision is simple. I'm voting for the override.
The member from Rice, Representative Bly.
Thank you, Madam Speaker. Members, we've heard some talk about politics, that this argument is political or that argument is political. And I'm somewhat discouraged by this. I'm someone who entered the political scene because I believe politics is a higher calling, that we're doing the people's work here. And we are working together. You have your ideas, your principles that you're arguing for. We have ours. It's not bad. It's not something to be embarrassed about or ashamed of. We are working together. You know, Jane Goodall, the writer who worked with chimpanzees, made the remark that when anthropologists discovered a human femur that had healed, that was the first sign of civilization. Because someone had to help that person to bend down and carry the load that they might have been carrying. That's what I think we're trying to do here. We're trying to help someone else out. Our side believes that government spending can be a good thing. What I hear from the other side often is government spending is bad in good times or bad times. It happens to be that we're in difficult economic times now, and we're going to have to all work together to trim some of our spending, perhaps. It's not the only way we could solve our problem, but it is something we're going to have to consider. I've heard the plea for trust. Trust us. We all want to work together. Trust us. We want to come to a solution too. It's discouraging sometimes when you want to make that trust. You know, I spent 30 years as a teacher working with sometimes very difficult students, and I knew that the only way to help them have the success is to see the goodness in their heart, whether or not they showed it very often, for whatever reason. I want to see you as good people. I really do. I want to work together with you and solve problems. We have a difference of opinion. It's a reasonable thing to have differences of opinion. But when I hear your leader say that he wants to take a 9-iron to government spending, it's discouraging. It's not necessarily producing of trust in me. And when I think about who's at the other end of that 9-iron, it's some of these people. We're talking about government spending here for a good purpose. Maybe it's not the best solution. Maybe it's temporary. Sometimes we have to have temporary solutions to a problem until we can get beyond and to a more permanent solution. I think we're all looking at that. Legislators come and go. Sessions come and go. We work our way through problems. We come back and revisit them. But we are working towards progress. I think that's a mark of civilization, that we are working towards something, a way to resolve the problems that we face. I really think and applaud Representative Murphy for, I think, coming up with a very good solution to a temporary problem. We all hope it's temporary. We hope that the economics that we face are not permanent, that things can get better, that we can find a way to reinvest in the things that matter in our state, and that we can come together and do that. Thank you.
The member from Pope, Representative Anderson.
Thanks, Madam Speaker. What I'm hearing here this afternoon is that we really have only two choices. The governor's proposal and the one we have before us today. And I'm also hearing that neither one is the perfect answer. It's not that perfect fit. It has to be fine-tuned. So it seems to me that if we vote today and overturn the governor's veto, we'll have the bill that's before us. But I really don't think that we're going to get together at 4 o'clock today and start working on trying to make that bill better. I think we'll have it for a while. But if the governor's veto is upheld, I would certainly hope that that committee, even though you've worked long and hard and maybe need a break, but I'd hope you'd get together again just as soon as possible to try to look for that bill that is better, that is that more perfect fit, one that we can all be happy and satisfied with, that cuts expenses, serves more people, because we all do want that final solution. So if neither one of these bills is a perfect fit, let's keep going and find the one that is a more perfect fit. Thank you.
The member from Hennepin, Representative Zellers.
Thank you, Madam Speaker. And like Representative Dean, I'll be brief. You know, for too many years we've talked about these kind of reforms and that are needed for some of our safety net programs so that not only can they be maintained for those that need them the most, but that they can also be affordable for the taxpayers who are paying for them. You know, we knew some of these programs wouldn't last, that this was going to come a day. We're this close on the reforms. The people who've worked so hard on this to come up with a fix are being short-circuited here today. Members, we can do better. We need to do better. We must do better. You know, we're starting reforming these programs with Representative Dean and Murphy. Was working in a bipartisan way, understanding full well that maintaining the programs for those that need them the most would also mean then that we were going to have to give up some, maybe on each of our own sides, some things that we hold most sacred. And members, not for 1 minute here today do I believe that anyone in this room does not want to find a solution for those that need it the most. I will not question your motives. I will not question your morality. I will not question your commitment to solving this problem. But members, we need to find ideas that work. We need to find a solution that works. I took Representative Murphy at her word when she said that this is an imperfect solution that we're sending out of here, that it would indeed include more work to be done on the bill, more compromise to be had by both sides. Representative Dean and Murphy and Huntley were here all weekend, part of the negotiations up until last night, as Representative Murphy documented so well in her memo. To come here today, Representative Bly, is to slap away that hand of trust. I agree with the Speaker. Trust is earned. I think Representative Murphy, Abler, Huntley, Dean, Gottwalt, Thiessen earned each other's trust, and they worked in a bipartisan manner over the summer, over the fall, over the winter. But that hand of trust was slapped away today by this vote. That earned trust goes by the wayside. The work that Representative Magnus has worked on with veterans to somehow accuse folks who may or may not vote to override the governor of not caring about those folks. Bipartisan work that Representative Magnus and many members of this body worked on. To deny that is to deny the work that we've all done in a bipartisan manner on behalf of our veterans. So, Madam Speaker, I'm not going to belabor the point. I agree with you that a signed bill is better than an overrid. I believe that Representative Murphy and Dean and Abler, Gottwalt, all the folks in the health care cluster, as well as all of us on the House floor, can come to a solution. And I'll leave by sharing something that a friend shared with me this morning. If we're going to work in a bipartisan manner, we're going to have to come across the aisle, join hands, so to speak. Madam Speaker, I ask that you hold hands and not grudges.
The maker, Representative Surdich.
We have to be honest with ourselves today. We have to be honest with ourselves with the choices that are presented before us. Representative Anderson, I very much considering the words you say and talking about the two choices that are before us. Neither perfect. You're absolutely right. But members, we have to be honest with ourselves today that these are the two choices that were before us when the governor vetoed the program last May, that are before us for the 9 months of negotiations and thoughtfulness on members from both sides of the aisle. These two choices were before us when we took a vote on this bill last week or a week before. They're the two choices that members worked on this weekend. And they're still the two choices we have before us today. I wish there were a third way. I wish in the next month, before this basic health care is taken away from Minnesotans, that there could magically be a third way that somehow bridged the divide between these two solutions. Members, we have to be honest with ourselves. There is not. We are each trying to do the best we can for all Minnesotans, and especially these Minnesotans. That's why people on both sides of the aisle, and I have a great deal of respect for those in a very complicated area of our state budget, have invested the time and energy, not just over the weekend, not just this session, but since last year. Members of the administration, members on both sides of the aisle, sitting down, poring over each and every idea they could to come up with the best option available. And we're down to two. We have to be honest with ourselves that there's not going to be a third option. I wish there was. But in life, in exhausting all these ideas, exhausting all this time, we've come down to two options. And we're out of time. We can talk about this for another month. As software is changing and notices are going out, we're already headed down that road of one of the two choices. And the administration is not turning that ship around. They've told us as much. And we can talk about it more and more over this next month, but it's going to boil down to these two choices. And that's why we're out of time. We need to be honest with ourselves about that. We can delay this vote today, we can put it off, but the choices don't get any easier. It's the option before you today, which is less expensive and covers more people, or it's going down this other path, more expensive, less time, less health care. I wish we could find long-term solutions. I'm sure those that are homeless, those veterans that are living under those bridges, are looking for long-term solutions as well. But they're also looking for the short-term solution too. And unless they make the short-term solution to live for today, they don't reach a long-term solution. And that's why I applaud Representative Murphy, Huntley, Thiessen, Dean, Abler, Governor Pawlenty, Commissioner Ludeman, and their staff for pouring their hearts and souls into finding solutions that work. But Representative Anderson and others, there are only two. I wish there were more. I want to commend this entire body for a respectful discussion today. There's a lot of talk about politics versus personality, politics versus policy. The word politic is Greek. It means people. And that's what we're voting on today. I've seen the signs, I've seen the letters that say, save GAMC. Members, we're not saving a program. We're talking about saving people's lives. So I think we each have to take a moment here before we vote and be honest with ourselves. Do you honestly think if we wait another day, week, or month, that there will be another solution that comes before us? I wish there were, but we have 9 months of proof that that is not the case. Because it comes down to these two options. We are going to have a budget forecast tomorrow, it's going to tell us one of three things. We have more money than we thought, we have less money than we thought, or it's about the same. That does not change my opinion, nor should it change your opinion on doing the right thing for these people. This decision will be before us tomorrow after the forecast. It's the exact same decision. And folks have said there's a lot of emotion in this, and there should be. If we made decisions as people, in government, without emotion, we're just computers. We can enter in the data and spit it out. I'm glad we don't do that. I'm glad we have vigorous debates. I'm glad we care. We all care. So I hope we all understand the implications of the votes we take. If I were appealing to your head, I would say it's an economic choice. It's a choice to do something. Voting yes is a choice to do something that costs less money and covers more people. If I was appealing to your heart, I would tell you that we're standing up for veterans, other homeless Minnesotans, showing compassion. I guess, members, I appeal to both your head and your heart. Let's be honest. We are down to two choices. I was home this weekend and I talked to someone who has a very good friend who is on general assistance medical care, who has cancer. And the only way they get treatment by going in and getting a shot that costs $3,000. And I don't know a lot about healthcare policy. I'll be the first to admit it, and if we're all honest in this room, most of us could say the same thing. And this is why I'm supporting this motion. Because this homeless person is supposedly going to get a letter to say they're going to be enrolled for a small amount of time in Minnesota Care. Members, how do we send out letters to homeless Minnesotans to tell them their health care is changing? That's the other option before us today. How are they going to receive that letter? Suffering from mental illness or chemical dependency? How are they going to figure that out? They're not. Let's be honest, they're not. This is uncomfortable, members, because we all know the pressure we're under. We hear from folks back home and what the right thing to do is. And no one can tell you that except yourself. I subscribe to the same philosophy that many of you do that Representative Ward spoke of. Voting first with your conscience, then your communities, and then your caucus. I suppose as a caucus leader, that's probably an unwise thing to say this early in session. But it comes down to being honest with yourselves. Do you honestly think things are going to change in the next month? That a third option is going to magically appear that wasn't seen by any of these smart people that have been working on this for the past year? It won't. This is it. So I'd encourage a yes vote for Minnesotans. I'd encourage a yes vote for our veterans, for homeless, jobs in our hospitals. Members, take a moment before you push your button, in your mind and in your heart, and do what you think is the right thing to do. And I hope you come to the same conclusion I do, that you vote for Minnesota today. Vote for insurance. Vote for health care. Vote for our veterans. please vote yes.
The question before the body is that Senate File 2168 now be reconsidered and repassed over the objection of the governor notwithstanding. The clerk will take the roll. Members, the House is under call. Please vote. The clerk will close the roll. Representative Surdich switches from aye to nay. Not having received the constitutionally required 2/3 vote, the Murphy E motion does not prevail, and Senate File number 2168 is not repassed. Representative Surdich.
Madam Speaker, having voted on the prevailing side, I move to reconsider the veto override motion, and I ask for a roll call.
Representative Surdich moves to, having voted on the prevailing side, to reconsider the veto override motion. He requests a roll call. Seeing 15 hands, there will be a roll call on the motion. On the motion to reconsider, the clerk will take the roll. The House is under call. Members, please vote. The clerk will call the absentees.
Westrom.
The clerk will close the roll. There being 93 ayes and 40 nays, the motion does prevail. Representative Surdich.
Madam Speaker, I move to lay the motion on the table and I ask for a roll call.
Representative Surdich moves to lay the motion on the table and requests a roll call. Seeing 15 hands, there will be a roll call on the motion to lay on the table. The clerk will take the roll on the motion to lay on the table. Members, the House is under call. Please vote. The clerk will call the absentees. The clerk will close the roll. There being 94 ayes and 39 nays, the motion prevails and is laid on the table.